Let me grab my gloves. I want to be.
Aseptic?
I want to be.
Aseptic? Is that how you say it? That sounded wrong.
So first thing you're going to do is you're going to verify you're at the right patient's room. You're going to ask them their name and date of birth, and you're going to verify that with the wristband, right?
Yeah.
And it's very important when you're drawing ABGs, you want to get correct tight-fitting gloves, because you want that sensation that to palpate that artery. You want that sensation. A lot of times, if you have really loose gloves, they can get in the way. So what I do is, if I'm palpating, I want to stretch this out like such. That way, I'm going to palpate with these two fingers. So after I realize that I'm with the correct patient, I'm going to explain to them the procedure, that I'm coming in to draw some blood. It may hurt a little bit, but this is blood work to let us know how well you're breathing and that kind of thing.
Do you ever tell them to look away?
No. I mean, if they have some sort of,
Phobia.
a phobia to blood, I may tell them to look away. So I'm going to open my blood gas syringe here. I'm going to open it up, and everything I need is contained in here. I've got my syringe. I've got my syringe. They usually come with two needles, a shorter needle and a longer needle. So if I were doing a femoral stick, I'd probably want to go with my longer needle. My needle, I've got an alcohol swab to clean the area before I stick them. I've got a piece of gauze to hold pressure when I'm finished. And I have a cap to my needle. I'm going to cap it off with this device when I'm finished drawing blood. And then I have a biohazard bag. If I need to transport this blood throughout the hospital, I can always place it in this biohazard bag and take it with me. They also come with this little patient place. Typically what you'll do is you'll grab a patient table from the chart, so you usually don't need those. So first thing I'm going to do is do my modified Allen's test, right? Of course, this patient won't do it. I'm going to, hold pressure, get him to release. I'm going to release my ulnar artery and make sure that everything pinks up, okay? Now this patient does have collateral circulation. So I'm going to take my blood gas, my syringe, and I'm going to put it together. So I want to make sure this is screwed on tightly. Typically when they come out of there, they're very loose. So you want to make sure that this is screwed on tightly. And I want the bevel of my needle. I usually like it to match my safety device here. So I have the bevel of my needle is at a 45 degree going this way, okay? Mm-hmm. So when I stick the patient, I have my safety device straight up. Because if it was down like that, it would get in the way. So I like my safety device to be straight up, okay? So I have my 45 degree bevel like that. I have my safety device here, and I'm holding my syringe like a pencil, right? Just like that. Now, there's two different type of blood gas kits. One, they have an autofill, which I think this is. So you want to compress this down all the way. And once I get my blood, it'll fill this and it'll push this stopcock back, okay? And there's other devices where you have to pull the stopcock back. Say if you want 2 mLs of blood, you want to pull it back to 2 mLs and it'll fill that up and stop, okay? And it all depends on what facility you work at. So I am going to hold my syringe like a pencil, like such. I'm not going to squeeze it, just very, very light touch. And I'm going to spend a lot of time palpating. This is the most important part in my opinion. I want to palpate. I want to find that point of maximal arterial pressure. And it may be fine tuning, just taking little steps back and forth like that, right? Just to palpate that pulse. And once I've palpated that pulse, I feel like I'm at maximal pressure. I'm going to take my syringe here, hold it like a pencil, and at roughly a 45 degree angle. And I kind of want to line myself up with the artery too. I want to make sure I line it up. What's that? Oh yeah. I'm so excited. I want to take my alcohol swab. I want to take my alcohol swab and clean it off. So I've got my alcohol swab that comes in the kit,
Oh, thank you.
and then I want to clean it off, right? So there's a really good method. You can start in very small circles and kind of gradually have your rotation get bigger. That takes all that debris and kind of gets it away from your site, right? So it's clean now. Thank you for that. It's clean. I'm going to let that alcohol dissipate. And once it does, I can get back to my syringe. Again, I've got it at my 45-degree angle. I've got my safety device here, and I'm going to palpate. Now that I have a clean wrist. Again, I want to fine tune that. I want to find that maximal pressure. And I'm going to hold my syringe like a 45-degree angle. I'm going to put it just in front of my fingertip here, like such. And I'm going to advance it. Now you realize this patient has no blood, so I won't be getting a red flash. I'm going to advance it until I get a red flash in this hub here. This is the hub of the needle here, right? So once I get that red flash, I can stop, and the blood will fill up my syringe, okay? So in the meantime, I always have this piece of gauze really close by. I usually put it like just above the wrist here. So this is going to ultimately fill up with blood, and I've got my 2 mLs of blood. I'm going to take my gauze. As I pull out my syringe, I'm going to apply pressure. Okay. So now I've got my safety device here, right? I never recommend closing this with the finger. Okay, because what if your finger were to slip and you were to, slide your thumb?
Okay.
Yeah. You never want to do that. So I always take my safety device and just close it on an object like that. So you've got your blood here, and now I'm concerned with the patient. I'm going to hold blood for up to 5 minutes, and I want to make sure my bleeding is completely stopped before I leave.
Is there enough pressure for it to actually squirt out, or is it...
No, it shouldn't squirt out, but in some patients it'll bleed pretty profusely. On some patients it'll just kind of bubble out. You're going to hold pressure up to 5 minutes. You want to make sure that there's no bleeding, there's no bump in the skin, there's no hematoma forming, and then you can place the Band-Aid on there if you like. Okay. Then I'm going to go back to my syringe. I've got my 2 mLs of blood in my syringe. I'm going to grab my little cap here. I'm going to take my needle off here, and I'm going to dispose of this in a sharps container. Then I'm going to take this cap. Before I put the cap on, if there's any significant air bubbles, I'm gonna kind of make sure they get to the top, towards the top of the syringe. I'm gonna put the cap on, and I'm gonna kind of thump all the air bubbles to the top. And when my air bubbles are to the top, I'm just gonna push my little stopcock here, and all the air is gonna be released. And this will be, once the blood reaches this, it's gonna seal it off, okay? So now I have 2 mLs of blood here. I'm going to place a patient sticker on it, a patient label, and I'm going to take it to the closest ABL machine, and I'm going to run it. And when you run it, you basically, the ABL machine will have a little siphon needle come out. You basically take the cap off, and the siphon needle will go in there and siphon out your blood.
Oh, so you just line it up?
Yeah, you line it up, the needle will come out, siphon up the blood. And it's always good to make sure that you have an ml of blood left over in case for some reason you need to run it again.
Does the blood clot? The blood doesn't clot in the needle, does it?
Very rare occasion it may, but usually it'll stay because this is a heparinized needle.
Okay. That makes sense. Okay.
Yeah, these are heparinized needles, so once you do get your blood, you do have a little bit of time to work with it before it clots.
Gotcha. Okay.
But there is that rare occasion where it's going to sit for a while and it may clot.
So
And they'll muck up the ABL machine and then
if it sits for a while, that's when you
ice it.
ice it.
Mhm. Yep.
That's what the ice and water's for.
That's what the ice water's for. Now, if it's a gas you're drawing the gas and taking it straight to the ABL machine, I probably wouldn't recommend needing even use ice. Years ago, we used to draw blood, like all our AM gases in our vents. We used to draw, 10 or 12 gases. So we'd ice those up and we'd send them all down to the lab and they'd run it.
Oh, okay.
Yeah, because they may be sitting around for 30 minutes. You don't know.
Cool.
So when are we gonna start doing this in like?
We're gonna do it in. We're gonna do it. We're gonna be sticking this guy next week in lab.
Thursday. And then the competencies on February
It's the
sixth.
following week.
Yeah, and the most important thing by all means is palpating with your fingertips and getting and realizing where that artery is, because ultimately what you have to do, if for some reason you advance the needle and you don't hit the, let's do this. I'm using my super long. So I'm at a 45-degree angle here. I've got a very, very long here. So this is what happens if you advance it and you don't get blood, okay? And you guys will realize that the depth of the artery, usually it's pretty superficial. You don't have to go very deep for a radial stick. Again, if there's an option, if you want to put a towel under here, you can. I'm going to palpate, and I'm going to hold this at a 45-degree angle, and I'm going to advance my needle. So I've advanced, and I get no blood. So I missed my artery, right? I missed my target. So now that I've got this in the skin, I'm going to use that as a reference point. So I'm either to the left or right of that needle, right? So now I'm going to palpate to the left and to the right. Well, I feel it more over on this side of the needle. So I'm going to withdraw. I'm going to keep it under the skin, and I'm going to redirect and advance again. Okay? Now I got my flash of blood, and it's going to fill up.
It don't feel good.
It probably does not, there is some pain, I'm sure.
Now, what you don't want to do is have your needle in there pretty deep and start moving it side. You don't want to do that.
Oh my God.
You always want to pull back, keep the bevel underneath the skin, and then redirect and advance. I don't think that hurts that much.
I don't know.
I don't think it hurts.
ABGs have been done on you?
I've done probably 10,000
I
of
don't think
these.
it hurts that bad.
I've done probably 10,000. Honestly, there are those people that say, "Did you get it yet?" And there are some people that say, "Cry." But redirecting is not that uncommon.
I guess since it's already under the skin, maybe it doesn't.
I mean, and it's just the bevel underneath the skin. So, so if you advance your needle, you don't get blood. You most important, use that as a reference. It's either to the left or right of that needle. It's got to be right. So palpate. You might want to spend a minute or two palpating, and once you palpate, pull back, redirect, and advance, and then usually you'll get your blood 90% of the time. And if for some reason you're just not getting blood, after about 2 sticks, you want to call somebody else. Okay, I'm going to take that and I'm going to close it like that and take my needle off and put it in a sharps container.
And the patient gonna be talking junk on some, that dumbass couldn't even get my blood.
You're the one that can't get my blood. Is she here?
They always,
Oh my god. Okay.
Any questions? Well, we're going to have lots of practice on this next week. And,
Will it have blood in it?
it will have blood in it. It'll have a active pulse and a pulsating blood.
You just got one?
What's that red dye number 3?
Yeah.
Oh, yeah, I saw that.
You got
Red
another
40.
year and a
Yeah.
half to use it. You have to find something.
So what do you do if somebody starts developing like a hematoma while you're
Well,
there?
initially you want to hold pressure, and if you hold adequate pressure, they should not develop a
Okay.
hematoma. If they have some sort of coagulation, issues, you may be holding pressure for 5 minutes or
How
so.
much is too much pressure?
You don't want to like occlude the artery. Just not much pressure. About, I don't know how much weight that is, but just a little.
As you're there, you'll still feel the pulse.
Mhm.
So you would know it was too much pressure if you no longer.
If you occluded it, yeah, just a little bit of pressure.
Okay, just a little bit of pressure. Okay.
Just curious, if they have a central line, can we get arterial blood from that?
No.
Okay.
It's got to be it's got to be a specific A line for us to get blood. And if this patient had an A line, we would certainly draw from that. Different method for drawing an A line. Central lines are used for that's more of a,
Like chemotherapy?
yeah, it's not specific arterial, so.
I thought a central line was arterial though.
Yeah, we typically don't get ABGs from central lines.
Okay.
When you pull from, the arteries, is there a chance that there is a hematoma that can form while you're in the arm?
Yeah, I would say so. I'd say it's very rare.
Oh, okay, cause it happens with venous blood.
Yeah,
like,
yeah, it does.
It just starts forming out of
Yeah,
nowhere and
yeah.
you're still bleeding blood.
Yeah. Because of the pressure, because of the increased flow with arterial blood.
Okay.
And thankfully having heparinized syringes helps.
Okay.
But there are some times where, you know, the blood comes out real sticky. It depends on their platelet levels and things like that, but you can get real sticky blood.
Can you show us, if you don't mind, how you would stick someone with HIV or Hep?
Okay. Let me
If
get
that's okay.
another.
Where, are they over there?
Yeah, I'll grab.
Where, there, I can see them under